Buenos dias, and thank you, President Rath, for the introduction and for hosting us, and thank you, Liz, so much. I am pleased to welcome our physical and web audience to the first 2020 workshop of the Roundtable on Population Health Improvement. And you can follow the conversation on Twitter using the hashtags Inclusive Healthy Places altogether and PopHealthRT. Before we go any further, I want to acknowledge the original placemakers and placekeepers of the place where we gather today, and pay my deep respect to Lenape people and elders and ancestors, past, present, and future. I acknowledge and offer deep gratitude to this Lenape land and that support us. And I invite you to join me in that acknowledgement, that respect and that gratitude. We acknowledge this land and the sovereignty of the Lenape people who have lived here. And because we're going to be exploring inclusivity, I also want to acknowledge that today we gather in a place where inequality still prevails and that inequality is fueled by exclusion. Therefore, on this day, we lift up this place, we lift up all the ancestors who have struggled for justice, and in their memory, we proclaim that we are the history of a just future. Since February 2013, the Roundtable on Population Health Improvement has been providing a trusted venue for leaders from the public and private sectors to meet and discuss opportunities arising from changes in the social and political environment for achieving better population health. The Roundtable's vision is a strong, healthy, and productive society that cultivates human capital and equal opportunity with emphasis on equal. This vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require robust national and community-based policies and dependable resources to achieve it. It will require your hands and feet, so yes, I'm putting you to work, and those of the people with whom you work to create inclusive public spaces. Several of the Roundtable's past workshops have featured work from around the country that has included a focus on the well-being of places and implications for the well-being of communities. This has ranged from the disastrous experience of Pittsburgh's Hill District, which was profoundly harmed by the city's so-called urban renewal efforts in the 1950s, to the more recent and positive examples from the work of Detroit Future City, to the Tenderloin Health Improvement Partnerships and the Hope San Francisco Revitalization Project in California's Bay Area, and 16 years and counting of placekeeping and climbing through Hike the Heights in Northern Manhattan. Today, we focus on inclusive public spaces because our health and well-being depend on much more than great health care. Public places in particular where we live, learn, work, play, workshop, and fall in love influence our health for better or for worse. Public places strongly shape who has an opportunity to participate, prosper, and reach their full potential for health and well-being. Let's use social capital as an example. Think about it. If an aspect of social capital is, in part, that you have it's a source of benefits acquired by virtue of a membership to non-family networks, I argue that public places play an important role in the size, depth, and heterogeneity of the networks we can join and the networks we can become members of, and therefore access benefits through those networks. Although this generation cannot claim we invented placekeeping and placemaking, just think about the people who gave us plazas públicas, squares, and other emblematic public spaces. In recent history, say over the past 30-plus years, there has been an increased attention to documenting the science and art of placemaking and placekeeping. And more importantly, research and thinking about untangling the connection between place, health, and well-being. Practitioners in this field have not consistently focused on the imperative to create and keep inclusive places. Placemaking is the work of creating livable, vibrant, or quality places, especially public places, and draws on community development, arts and culture, regional planning, civic engagement, combining different disciplinary perspectives into a creative way of shaping public spaces, land use, commerce, transportation, housing, and social fabric. Harmful consequences of placemaking include gentrification and displacement, racial and socioeconomic exclusion, and lack of resident leadership. Placekeeping is the work of stewardship that is fueled by the sweat equity of people that care for, use, and program, in the most extensive use of the term programming, public spaces. Contemporary approaches to inclusive placemaking and placekeeping are still imperfect, but improving. And today, you are all tasked, myself included, to shine a light on state-of-the-art thinking in this work. And I'm challenging all of us to do our part to harness and amplify the immense value that could come from creating and keeping inclusive, healthy places. The objectives of the workshop are listed online, so I'm not going to read them. But let me just do a big walkthrough of our agenda. We will start with anchoring the day's discussion with a fireside chat discussion about inclusion. After that fireside chat, we will explore 3 case examples from Houston, Detroit, Richmond, California in a fantastic panel. And then we're going to switch gears to hear about perspectives from people in the forefront of placemaking and placekeeping. And we will end up together with a group thinking exercise and final reflections. And now I have the pleasure of inviting Laura Torchio to start us off with an exercise. Welcome, Laura.